The World Health Organization reports that a strain of the coronavirus that causes COVID-19, which was first detected in Colombia in January, has become a variant of interest. It will be closely monitored for signs that it could be resistant to the vaccine that have been approved. The variant SARS-CoV-2 has a constellation of mutation that indicate potential properties of immune escape. This development is of concern to health practitioners in the Caribbean region, including the former permanent secretary in the Ministry of Health, Dr. Francis Martin. He explains that a new variant is normally developed when the spread of a virus is at its peak in a country.
Across the world, whenever we see a country with very high transmission rates, usually variants occur. The English variant was the same, the South African variant was the same, and closer to home, the Brazilian variant occurred when Brazil was at its highest transmission rate. And similarly, the Delta variants occurred when India was experiencing very high transmission rates. I've always been concerned and continue to be concerned that if the Caribbean is not careful and we experience a high transmission rate here in the Caribbean, it is quite possible that we ourselves may develop our own Caribbean variant. And now that we have an additional tool, which is vaccination, that we quickly consider vaccination as a way of preventing the transmission of high transmissions and decrease the chances of variants.
Although there has been less than 10 COVID-19 related deaths in Grenada, thousands of people around the world have succumbed to the virus. Families are unable to say a proper goodbye.
I must say however, though, that the WHO has sanctioned burial of people with COVID-19. So it is okay to bury those persons, but some countries, depending on their priorities and the local circumstances, may choose to cremate. Especially as it's a new virus. Families had no time at all to grieve when their loved one died from things like COVID. Even while they were alive before they died, they didn't have a chance to say hi or relate to them. And this is really adding to the enormous psychological burden that the pandemic is causing on people.
Director of the Pan American Health Organization, Dr. Carissa Etienne, is concerned about the recent development in the region as more people become affected, putting healthcare systems under severe strain. She notes that more than a third of the countries in the Caribbean region are yet to vaccinate 20% of their population. In some places, coverage is much lower.
Vaccination rates remain in the teens in several Caribbean and South American countries, and coverage is still in the single digits in Central American nations like Guatemala, Honduras, and Nicaragua. We need to deliver an additional 540 million doses to ensure that every country in the Americas can cover at least 60% of their population.
Dr. Etienne urged countries to place emphasis on vaccinating the more vulnerable segments of the population, such as the elderly, health workers, and people with pre-existing conditions. For GBN News, I am Rena Pierre Thomas reporting.